Welcome to another episode of MyData Zurich. This is our second short version of the full webinar. As usual, you find a link to the full recording in the comments below. This summary provides the key takeaways from today's 4 guest speakers and their view what the future might bring.
Thank you. My main message today was that there are kind of 2 flavors to MyData and data protection. And one is the one we know from German-speaking countries: don't store my data, don't share my data, don't even record my data. And the other one from Nordic countries is much more pragmatic and saying, let me choose where my data is being used. Do store my data, but allow me to control where it's being used. And I urge you to look at that point of view as well, because we do need the data to be processed.
Sure. My thoughts are on let's move away from evidence-based medicine and move to real-world evidence-based medicine and precision medicine in the future. That's the MyData way, and if we're in control, nobody will complain.
Data is key for good diabetes care. So let's design solutions and services that fit with users' behavior and users' self-declared requirements, patient-centric, but let us establish systems that allows the data flow between patients and care providers.
I think we need a person-centered data integration with these intermediaries that can help you control your data for your benefit. And that will also, in the end, benefit the society and everybody around it.
Today, we focused specifically on the medical sphere, and I think it's a good example, but of course, there's much more at stake. And for Switzerland, I think there needs generally to be more awareness of what's going on. So more public awareness of what is happening in the health system. Politically, there needs to be more awareness. And basically, this is, of course, also where we come in as Swiss Data Alliance, that we want to raise awareness and leverage change in these parts. But I think, it's a certain mindset that has to happen first. It's a cultural shift.
Markus, in his presentation, referred to the Diabetes Excellence Center. So we would get data to doctors to be analyzed, specialized doctors to be analyzed. I would say already in 5 years, we should be further than that. In 10 years, definitely, we should have just algorithms analyze the data and see, okay, these are the patients that are doing really well. These are the patients who have been doing well, but are now declining. These are the ones that we should put the efforts on, and so on. So I totally see algorithms and later AI, even AI, helping us. And to get there, we just need to get the data available for the algorithms and the AI to learn how to behave.
I think that we will be at the point of active insights for all people living with diabetes. I also think that we will have vaccinations or gene therapies for type 1 diabetes within 5 years from now, as being part of the vaccination programs for the people with the right gene setup for that to work. So active insights for all diabetic patients. Share the data. Get the data flowing. That's the decision. That's what needs to happen.
What matters in the future are still quality and cost. And in order to get this aligned, we definitely need data and we need digitalization. And we have to start now to fill the necessary data lakes for applications as artificial intelligence and algorithms, indeed to improve the quality of care and give a better life to patients.
I think that in 5 to 10 years, I would like to have the freedom to share my data to get the best treatment. Somebody can look in my data. What do I think we decide today? I think we need a common consent model and also a payment model for all these stakeholders, because I think it's more a political problem than a technical problem. So I think that everybody needs to have a win-win system and not this the winner takes it all.